Hey everybody, Reagan Archibald here with Go Wellness, and today we're going to be talking about how naturopathic doctors can really explode their practice with none other than Dr. Greg Eckel out of Portland, Oregon. So Greg, how's it going?
Oh, it's going really well.
Great. So what would you say? I mean, you've been a naturopathic doctor 17 years now. You've sat on the Oregon Naturopathic Association. What's your current role in the naturopathic world in the state of Oregon?
I'm now just a practitioner. I spent 6 years on the Oregon Board of Naturopathic Medicine, appointed by the governor. I was the president of that board for 2 years, and I'm definitely involved. Involved with the association, involved nationally, and I love the profession, and that's why we're talking.
Yeah, exactly.
Yeah.
And Greg and I have been good friends for years. And recently I said, Greg, we've got this mission at Go Wellness. We want to help 1 million people in pain and chronic disease by 2025. And so that's the vision we put out there. And Greg says, I'm on board. And you've got an amazing practice that you run there in Oregon. But where do you think the naturopathic world and the physicians, first of all, what's the struggle that you see in the naturopathic profession and what can we do about it?
So we've got such a chasm of practices, and different states have different licensure. Some don't even have licensure. And what I saw, the opportunity at Go Wellness and the tribe that you put together, these heart-centered practitioners, we just get beat up out here in our individual practices. There's not a lot of support. There's not a lot of information, and there's no systems developed. You definitely don't get it in school. We've been out, 17, now it's 18 years, and it is, it gets one, lonely, and two, you get a little bit lost out there of like, God, it's just a grind. Insurance is killing me. I got billing, I got headaches. It takes the fun out of it. And I have fun in my practice. And a big part of that is the support that Go Wellness and the tribe there has put together for us. Is you've got the systems developed, you've got the support to help even my staff, So we've got, you've got an office manager, practice manager, front desk person, the doctor's doing everything. I just went out to dinner last night with a friend. She's charting until 9 o'clock every night. It's like, damn, that is not why we have a practice. We really do need to be supported in this thing. And having, the light beings of Go Wellness on our team, that's why I really want to get this message out to the naturopaths of, we can all join forces and actually change healthcare together.
Beautiful. Yeah, and I look at that and I've seen, over the years, the amount of administrative work has increased and the amount of face-to-face time with patients has decreased. And then we're getting sicker, we're getting fatter, more depressed.
Yeah.
And so it is a trap that a lot of doctors have gotten themselves into. New research that came out of, I think you'll find it on study.org. And it showed that 2/3 of doctors out of 600 doctors that were interviewed, 2/3 say they would not recommend that anyone went into this medicine.
What a shame, And also I think the suicide rate is huge in those practices, right?
Yeah.
And possibly not in the naturopathic world, but because of the heart of these practitioners, but it's sad. It's a sad state of affairs of what is happening to medicine. And I really think our professions and our alliances are the thing to bring back the life, kind of bring back the heart and care into our medicines. So where we can help millions of people. Like, that is such an attractive goal, where we all sat down at a meeting this summer, that you put together, and we did the math, and it's like, we can actually do this. Like, what a fun game. Like, we can help and serve so many people,
Right. And I mean, I think there's no one poised better than the naturopathic physicians, because the great thing about your licenses is you can do the regenerative medicine in most states. You can do the functional medicine. And I mean, in a lot of naturopaths, you can do acupuncture. So those are all the primary modalities that we're training on at Go Wellness.
Yeah.
And so it's very easy from a clinical side. And now, as you said, like, let's think about the other people on the team, and maybe we can offload some work on to your case managers, your office managers, front desk.
And that's the piece that I don't think we really get in the naturopathic model or anywhere really. There's not that model of, you think, oh, getting busier means more work for me, but I'm already overworked and overstressed and overwhelmed.
Right.
And this piece is so brilliant because you have been at it and you've got a great model with your 5 clinics and, in helping all of these other clinics around the country around, no, this is actually how, you make your life better. Right? You bring people in that help you serve more people. They bring you more revenue and actually give you a little bit more time off. Those 3 aspects of, no, you actually can grow a business that changes the community. Like, that's why we all got into this medicine. And this is how you do it. Like, you've got a great working model. It works, like that's the thing that you've got clinical works, you're always innovating, you're bringing the research in, and what I love, I can take my staff down there, I don't have to do the training. Early on in my career, it'd be like, I can't do that, like, what are you talking about, case manager, and put that over there, like, I don't even have time to finish my charts. And
Right.
that aspect is, it's so fun, it brings back the fun and the life and the energy of what we're doing, and the patients feel it. It attracts the right people into the practices. We're getting phenomenal results.
Yeah. And so what's changed for you? I mean, if you go back into early days where you didn't have a business model, where it was like, it was just Dr. Greg, it was all on you. And then what was your low point? What actually helped you decide you're going to change the way that you're functioning in your practice?
I got to a point where, I was spending more time at work than I was with my family. I had young kids, and just not getting there. It's like, what the hell? I can't take a vacation. I can't go anywhere. I'm supposed to be going into business as an entrepreneur for myself, and
Right.
the business owned me. And then you get into the insurance therapies I can use with my patients. And I thought, I'm playing the wrong game here. Like, I got into this to help people. And now I've got this like third entity sitting in here that that is just, they're not even in the room. And so it's like
Right.
dictating, I got to get prior auths to get treatments. And like, I can't do Moxa with that person, or, I got to remember all the different plans. And
Right.
I just said enough. Like, I'm in it to help people. I blow through that. Yes, I have a hybrid model still.
Yeah.
And but the insurance is kind of like an added bonus for people. It's not going to get them well. It's
Right.
not healthcare, right?
Mm-hmm.
And that mindset shift. So it was a huge mindset shift on of beings on the planet. I know how this stuff works. And every year I'm just so impressed with what our bodies can do and what the medicine can do. But it's like, you got to get that thing that's sitting over there hovering in your office. You got to get them out, or
Yeah.
at least put them in the corner where they belong. They don't get to dictate what you're doing.
Well, I love what you said. You suddenly you went into business as an entrepreneur. You said, "Hey, I'm going to be a doctor," and we realized, like, okay, we put hundreds of thousands of dollars into our education, and you think I'll have a little bit of freedom, but then you said it perfectly. Like, the business started owning you. You didn't own the business; it owned you, and so that fundamental shift where you finally get tired of it and you say, man, enough is enough. And then when you have this other third-party entity called the insurance world,
Yeah.
you're like, and this person is not contributing. They're just like fighting back. And you're like, hey, I've delivered the service. I did a phenomenal job. But they're like, no, it wasn't good enough. And so fill out these forms.
Didn't qualify. Right. We want to see your chart notes.
It's not medically necessary. Yeah, you've seen it all. And that's one of the things in that same study that I looked at this morning. 87% of doctors in this survey said that insurance has made medicine worse.
Oh, yeah.
And so,
I mean, who can't go into agreement with that statement,
Yeah. They just said, yeah, they wish it was just gone entirely. The only 13% that probably wish that it was are probably doctors who haven't really dealt with it firsthand. It's probably employees at clinics. So I think, the fundamental thing that I'm seeing is we're at this breaking point in in healthcare. I mean, it's like the crack is getting larger and larger. It's like an earthquake waiting to happen, and more people are migrating out of the system. We said, okay, with Obamacare, let's try it. We did it for 8 years, and we're like, wow, that made things way worse, having everyone be card-carrying members.
Right.
So now we're at this crux where if we don't have great entrepreneurs that can come on board who are health-minded, and this is why naturopathic doctors are so key in this overall mission, because you guys went into naturopathic medicine because you have a philosophy that is holistic based. It's not, let's just treat the symptoms, get the patient off to the next patient. But if naturopaths don't have a business, we can't solve this major problem worldwide.
So true.
So our goal, our goal is like, let's provide a business system and a model to create more freedom in the lives of naturopaths, but also so we can work on our transformative purpose, which is change healthcare in America, really give people the core things that they need. But if you could just give people kind of 3 keys, what are 3 things that someone could do right now, a naturopathic doctor, to start changing their mindset and changing the way they're operating?
One is get around other practitioners that are doing it, right? You don't have to recreate the wheel. There are successful models out there. So being around others that are doing it, you go to so many meetings and like the vibe is so low in some of these, society meetings and or gatherings of the tribes. And it's like, well, what the hell is going on? Like, we're getting beat up. So that would be number 1. Number 2, think of programs and systems with your patients. So don't get out of the one-off or like what's going on today. You've got to have the path to Wellville figured out before they're there. So you've got to have a system to be able to handle that as you go forward. And the third is really, you got to invest in yourself. Your vibe has to go up. Your energy's got to go up, because that's going to attract the right energy into your practice. And, those 3 components, I mean, the mindset, I saved the mindset for third, but that really is the biggest shift, the biggest thing that people can do. And that's the component about what I love about Go Wellness. And I mean, you guys helped me through a very hard time in my life, and it was phenomenal. Like, the amount of support and love and information, like, transformed my practice. And that's why I'm jazzed up to bring more of my naturopathic tribe into Go Wellness, because that synergy is so important, and we can actually change healthcare. We can bring back the heart and, really help a lot of people. That's really what it's about. Yeah.
I love it. And so, of those, one of the key things that you touched on, Greg, was, getting with the tribe. And so what changes? I mean, I've gone to events too, and I'm like, my energy was worse when I left. And I was like, or I've actually gone in, I've sat in a couple hours, and I'm like, I paid for the whole weekend, but I'm not going to waste my time here anymore. And so I just bounce. And my wife's always like, what?
What did you do?
I'm like, my time is so much more important than that. That money is I learned it. I learned that I'm not going to go to that organization again. But when, maybe you talk about, what's it like for you when you come to a Go Wellness event? What's it like energetically?
So it's really, like I say, it's a bunch of light beings down there. It's so uplifting because everybody is on purpose and on mission, and the docs and providers, they're all taking practices are abundant minded. They're abundant minded practitioners. So it's just this whole energetic riff that comes together, and, it just charges us up. It's a lot of fun, and we have a lot of fun. So we learn a ton and we have fun. So those aspects of the gathering and the tribe of what Go Wellness is doing, I mean, it's transforming lives. Like, that's why we got into medicine. And it's to support each other and, hear what's working. Like, we're pulling all of our data as well. That is so exciting to me, so that we can really speak with confidence and truth to our patients and our communities of, this is what we're finding is working. And we're part of this affiliated network of clinics. Like, that's what we're doing.
Yeah. Well, and the beautiful thing is, like at the Lasco Wellness event, we're at Snowbird, we're skiing, we're having, business conversations, we're sharing ideas because
Yeah.
we have a policy like it's be completely transparent.
Yeah.
Let us know what's working because nobody, if you have one thing that's like really exploding, share
Yeah.
it with the community. And so you came and talked about brain derived nootropic factor, and everyone's like, wow, that was awesome. And then
Yeah.
the event before, you're talking about DMSO and how you can use it intravenously. And so it's, you bring your expertise and it just helps the entire organization grow. So yeah, we
Awesome.
are looking for, that is the mentality. But then the other thing is we want to plug your case manager, your office manager, marketing director in with other people who are doing the same job. And then
Yeah.
they can mind share. And then what
Yeah.
happens is suddenly your whole team is pumped up, they're on fire, and they're ready to
Yeah.
go. So it's not just for the business owners, it's actually more for the team than it is for the business owners.
And that's such a great point, because I've been taking my team for the last 2 years and they come back with ideas. They're networked in with other people in other offices that are doing similar positions, and they're jazzed. Like, they're like, hey, at the meetings, so it's not just all on me anymore. Like, we're all in it together. And it's such a great way to create that. The team, everybody's rowing in the same direction. Everybody's on board, and they're fired up too. They get it. Like, wow, look at these other people in other offices. They're doing similar stuff and they're nailing it. Like, they're hitting it out of the ballpark. They're part of the care team. They're getting people committed into care. And yeah.
That's beautiful. Well, and we have some of our business owners who I haven't seen them in like a year, and I'm like, hey, I know you're setting your team, and that's cool, but I want to hang out with you. So
Yeah.
don't do that to me. But no.
Yeah, totally.
So the second thing you touched on is you said get away from the fee per service model. Start putting in programs, because where I see people fail is it's a transactional experience. Like, well, I can go to the naturopathic doctor and they'll spend an hour with me and then it's $300 or whatever the fee is. And then they give me supplements and then I come back in 3 months and it's another $300 and another bag of supplements. And so it's just kind of like this guessing game where, let's see what will happen after this visit. And then you're kind of on your heels the whole time in healthcare. And as a patient, it's unsettling. But so what have you done to solve that problem?
Yeah, so they're basically, I'm probably one of the most expensive naturopaths in Portland, Oregon. And I'm fine with that because the experience that I've got here is far different. Like, I don't want to be a commodity. Like, don't treat me as a commodity. Like, people calling up, like, how much are your IVs? It's like, wrong question. Like, what is your problem? Like, how much are your IVs? Like, you're just about the IV, right? So it's getting out of that mindset of it's all about the therapies. It's really about how do we best serve the patient and really hold the space for them and create a program where they feel embraced, supported, and that transformation can happen, because it is relational medicine and the heart has to be in it. And so by getting into a program mindset, like, these are the things we're doing. It's all of it. It's full court press. We want to get you up to, total functionality and correct the underlying imbalance. And then we start to take therapeutics out. Like, that aspect, and coming with such certainty for them and knowing and understanding, like, this is how it works because we've been at it for so long. Like, that's how we can demand what we charge for our services, because basically it's the experience and the transformation. It's not about the pieces and parts. Like, they get enough pieces and parts in Western medicine and from other functional clinics, from the chiropractors and acupuncturists and naturopaths that are just doing their small little, like, okay, here's these supplements and, here's this diet plan and, maybe we'll do some testing over here. It's all of it is included at the beginning.
Yeah.
And it's made such a big difference for people just come in and say, wow, where have you been? Like, this is what I've been looking for. And it's such a pleasure to provide that type of care to people too. So that's the biggest thing, really putting all of that together in one presentation to people. Yeah.
Yeah. It makes it's like, okay, all you're going to do is yeah, you put all the testing, all the treatments, any
Yeah.
therapeutic, and then all the coaching that they're going to need. You just put it in one fee. And then the person's like, finally, someone's actually looking at everything A to Z, and they're not taking shortcuts on my health, because I've been struggling with Hashimoto's or leaky gut or whatever their autoimmune disease is. I've been struggling with this for 10 years. And all the doctors do is, naturopathic world, acupuncture world, they just give me this one-off thing. And I think that idea is bred more by the insurance industry, where we're trying to like check the box so we can submit all the codes and get paid for all those little fee per services. And then we just kind of translate it into real practice. But we got to change that.
It is so liberating to basically get out of that box, because then like the magic and the fun comes back in there. Like, oh no, we can actually do all of this. Like, it's all of the medicine. It's not just that piece that is, allowed or in the contract. So that aspect of it has been so refreshing and energizing, and it just makes it more fun.
Yeah. Well, and the end result is the patients love you because, they made a significant investment, and studies show that the more someone invests in something, the higher their commitment level is. So do you want a $300 commitment, or do you want like a $6,000 commitment? I mean, every single time a $6,000 commitment will get a far better result than a $300 commitment.
Oh my gosh. Yeah. Those people show up. They show up.
Then they're happy. They're stoked about it, and you can deliver 100% of your medicine. You're not fighting them over like, hey, I need to see you more frequently so we can make progress. Those people who invest up front, they're just like, let me in the clinic. I'm ready to go. I'm going to do everything that Dr. Eckel asked me to, because I made the commitment up front. And so it's a commitment to a bigger future for them.
For sure.
We look at it, and in all the programs, at the end of the day, health independence is what we're really after. We want people to be independent when it comes to their health, where they can be fully expressive, they can freely move, they've got mental clarity. And so those are some amazing things. And you've got kind of a unique blend. You've got the naturopathic world, you've got regenerative medicine. In the regenerative medicine, I mean, stem cell therapy is a big thing you've started adding into your practice. Has that changed things for you? And if so, how?
That has been so phenomenal. I can't speak highly enough about it. And that's really, what you guys have trained together, and the experts that you have speak at these conferences on that has really, really excelled us to the front of the line in the regenerative medicine world. And, there's nothing like having, a 76-year-old woman that's slated for knee replacement. She already has her left knee replaced, give you a big hug, like a stem cell procedure. She's pain-free. She's out playing with her grandkids.
Yeah.
He was out jet skiing over the summer, like case after case, that stuff. Like, this is such an exciting time to be practicing and to put these therapeutics in there, even for me in the chronic neurodegenerative world of doing some really cutting edge things, getting phenomenal results for conditions like Parkinson's that don't have anything really. Meds, and they decline. And these patients are so frustrated. They're like, I'm just getting serially monitored. Could have told them I was getting worse. Like, they needed to do those tests, and I could have just come in and said, yeah, I'm worse this year. So we've got stuff where we're showing results. I'm not saying we're curing it, but we are really, we're changing the tide and the momentum for these folks, improving their quality of lives. And it's just, what a great time to be alive, really.
It's wild, isn't it?
Yeah.
I just interviewed Elliot Spencer, with Utah Cord Bank. He's one of the PhDs we bring in to just give us our biology lesson for the event. But man, it's crazy just to see the progress that he's made in the last 2 years with the perinatal tissue. So check out the podcast. It's you'll find it on Go Wellness Radio. But yeah, phenomenal. Yeah. So the third thing you touched on, which I think is probably the most powerful thing you said, is you've got to invest in yourself. And so, we talk about getting with like-minded people, getting in a tribe, getting your team in their tribe, getting your treatment plans, getting the right philosophy around those. That will transform your practice. But the biggest thing where people they drop out fast is when it's like investing in yourself. Because and why do you think doctors don't invest in themselves? And what do you think causes people to hold back?
I can remember back before I started getting any coaching or support, and it's scary because you don't have a lot of income, and you don't want to take a gamble.
Right.
So it's like you're really having to, kind of do a leap of faith of like, this better work, right? So kind of that commitment level that you're talking about with the patients, that's what I found for me as a practitioner. I really needed to like double, triple, quadruple down on myself, because without me, the thing doesn't go.
Yeah.
It really invest, like if I'm going to invest, I've invested so much up here, with our educations and schooling and continuing education. But, really basically, I feel like my heart and soul of like, I got to keep me well. And to do that, I've got to be around people that are going up, like, and expanding and abundant and, full of energy and life, and really in it for the right things to help thousands of people, right? Or million. We got 1 million people by 2025
right
now on the table. And I think we can do it, right? And we bring more people in, we can get there quicker and play a bigger game. But it's that aspect. It gets a little scary, right? I'm going to commit with my dollars into this program. And, I think it is scary for it. And, we see it, I'm sure you've seen it a bunch around, folks that do it, and then they just start doubling, tripling, quadrupling their practices because they get it. You can actually see, this is how it works, because you've got some just high flyers in your program, Reagan. And it is, it's amazing. I learned so much at lunch, at dinner, on the ski slopes, the conference itself. And, that aspect of, but it's so juicy of, the question is like, why not? Like what you're really missing out by not committing in,
Yeah. And I think it is interesting in Go Wellness, because we have people who are just starting out and they're struggling just to pay the bills. And it's like every last dollar they're investing into this, and every single time they've been like, I'm so glad, because I have this, I have a moral obligation. Okay. If you invest $1,000, you're going to get $10,000 back. That's our guarantee there. And so, but then you're sitting in a room and you've got these practitioners who are brand new, and then you look around and there's practitioners who are doing far bigger things than I am in our practices. And they're just humble and they're willing to share. And it's just like, it's just such a cool environment. And we have all different walks of life. I say I'm no respecter of your credentials. Like we love our MDs, we love our acupuncturists, I love our health coaches, I love our naturopathic doctors, our chiropractors. I don't care what's behind your name. I just need healthcare entrepreneurs. And that's really what we've created, is an environment where an entrepreneur is someone who is adding value to society all the time. But if someone doesn't invest in themselves, this is where I see as tragic. I see them working a couple different jobs. I see them, trying to like keep their clinic open 7 days a week, and it just never quite works out. And so,
they just burn. They burn out,
Yeah. And I remember the first coaching program, I had to put it on 2 credit cards, and this was with David Singer, and I was like, man, all right, I'm going to try this, and but I had to go all in. And once I went all in, I was like, okay, I learned the systems. And within 3 months, I doubled my practice. It was crazy. And so I think you probably, do you remember what your moment was when you just finally had the sweat dripping off your face and you said, I'm going to do this?
I think it was just on, many, many sleepless nights of like, how the hell am I going to keep these doors open? Like I'm working more than, I had a big clinic at the time, and I was working more than everybody in there. Thought, I've got this entirely backwards. Like, what am I doing here? This thing is supposed to serve me, not me serve it. So I just got fed up with it. It was like, no, I need my life back. Like I need to get out there. I know that there's a working model out there, and I know it can work for us. and, you know, being around people that it is working for, it's like, no, we can support each other in that, because there's not a lot of people with that entrepreneurial mindset in medicine in particular. I think, you know, it's a rare breed, medical entrepreneurs, and to bring them together in a Go Wellness model is so potent, because, you know, it is really heart-centered. That turns a lot of providers away from business, right? In that it's like, oh no, I don't do I'm in it, you know, to serve people. It's like, okay, well, how many people are you really serving if you're playing small? So I got kind of just set, like, why am I playing a small game? I need to play a big game, because this medicine, people are literally dying for this medicine. Like, there's not a drug we can't get people off of. You know, we get a ton of spontaneous remissions at Nature Cures Clinic. And it, you know, so that's why I'm out, and why I wanted to talk with you about this is, like, let's get more people in that want to play that bigger game and transform healthcare to help people. Like, they're dying. They're almost treated like commodities to just push more drugs into. And so, like, let's put an end to that business.
Love it. Yeah, I think it's so important. And you just really, I think that's a great, you know, kind of a great way to like look at things is, what do you want? What kind of impact do you want to make? And you got two choices in life. You can either like shrink and go downhill, or you can just like really go bigger and bigger. And a lot of practitioners, they kind of reach this plateau and they say, okay, this is what I wanted to do. I wanted to get my practice to this level. And then they try and keep it level and stable. It's impossible. You have to keep growing. And the universe will come and take your practice, and you'll have to exit it, or you can keep growing. I mean, that's what I've seen time in and time out, the hundreds of practitioners who've been on our Go Wellness program. The ones who succeed, the 95%, they're always growth oriented. And so I think, you know, one of the things I've observed too is doctors don't invest in themselves, is because they don't really believe in their abilities to grow a team and to create more freedom in their life. They've been so beat up for decades that they're like, there's no way. I mean, you know, Dr. Reba in our program out of Albuquerque, she's like the classic example where when she and I sat down to talk, she's like, look, I've got two choices. We run out of money and everything's gone in about a month, or I have a little bit of credit left on this credit card, and I can take a gamble and a risk on you. But she said, look, I don't even feel like it's a risk. I feel like this is the gift of the universe where I can actually come learn how to put in some business systems. And if you look at her now, she's one of our most successful doctors. I mean, she's got a jam in practice there. Her mother passed away. I mean, she had her own, you know, kind of unique event like you had. And, but her practice was able to still keep functioning, even though she had so much time away from it. And so that was a real gift to her.
It's amazing that aspect it's really, you know, it's like, did you get burned by an employee? Or it's like, I hear a lot of practitioners say, I don't want any employees, I'm going totally micro. It's like, well, what happened in the past? Like, the only way to serve more people is to bring more people on board to support you in your kind of unique ability to actually do the things you love. Like, you can actually set this game up that way. Like, we can set it up to win. We don't have to set it up to lose.
Exactly.
Yeah.
And I think that's the whole thing. If you get that foundation, you get with the right-minded people, we're going to train your team, we'll get you trained, and then you put in the programs that are all encompassing, so you have more freedom to use your medicine with your patient, instead of just being like, man, I'd love to do that intranasal stem cell procedure, but I didn't put it in their program. It's like, no, and up front, you're going to know how to put in all these cool pieces of medicine. And then at the end, it's this constant process. When you invest in yourself, that means you bring your best self to the events, you share your knowledge like you have, Greg, which has been phenomenal. And then you bring your energy, you have fun, and it's just this cycle that can keep you refreshed and recharged so that you can go serve more people. Because we do have a big mission. I have to argue that there's probably no greater cause than helping people get rid of pain and chronic disease. And so Yeah, really love to have people who are like-minded. Love what you brought to Go Wellness, and I'm really happy that you are our official naturopathic
Yes.
consultant. So Greg is he's your man. He's your go-to. For those of you who have listened to this and he said, "Man, I would love to find out if I'm a good candidate, if I'm a good fit for this program," we have a link below. And then what we'll do is we'll schedule a practice assessment for you, and there's no cost. And Annie is typically your contact for that. It'll be Annie or it'll be Cade, one of our directors at Go Wellness. And they can help you get linked in. And then we'd love to see you at the next event. And so they'll get you all the details on that. But any final words of advice for people who are, out there in the naturopathic world looking to take their practice to the next level?
Yeah, kind of click on that link and get on the phone. Like, have a conversation, because it can really change your life and change your community's life, your family's life. Just check it out. It's worth it. If you're still listening with us now, so come join us.
Yeah.
It's really.
Love it. Appreciate that. So do that. We don't put you in a headlock. We actually are very selective of who we choose. And so unfortunately, we tell almost as many people that want to get in, we say, probably not yet, because we are looking for like-minded individuals. But click on that link. I know if you've stuck with us this long, you probably are someone who we're looking for. We're looking for you, the healthcare entrepreneurs out there. So thanks so much, Dr. Eckel. Really appreciate everything you're doing, and can't wait to see you in a couple weeks.
Awesome. Take care.